Okay. Welcome to the Pieces of Systematic Review with Margaret Foster, Session 4. Thank you, everyone, for joining us. It is my pleasure once again to introduce Margaret Foster, Associate Professor at Texas A&M University and Systematic Reviews Coordinator at the Medical Sciences Library. Additionally, she has a joint position at the School of Public Health and the College of Medicine at the Texas A&M University Health Science Center. And we will go ahead and turn it over to Margaret.
So good morning. So today's session we're going to be looking at mostly free software. I will be mentioning a few softwares that do have subscription costs, mostly as a comparison. And just as a reminder, there is a Google site that I created especially to have links to all of the different tools that I'll be talking about, especially today. Today will be mostly a series of different tools to kind of walk you through some that you might consider using. So that's shown here, along with our hashtag for anything you want to tweet or ask about, you could put there. And also you could ask questions or make suggestions in the chat box. So just as a reminder, this is session number 4. Next time we'll be talking about other types of reviews, and then our final session in July will focus on some new developments coming up in review methods. And will also be a time to kind of wrap up and answer any other questions that you may have. So today, the objectives are to talk about the different types of software that you or your client may want to consider, what to look for in software, and then I'll talk about a few specific software products and ways that I have found make them a little bit easier to use for systematic reviews. So this is the pieces flow workflow for systematic reviews that we've been kind of talking through. And so the P stands for planning, and there are some tools out there that are just for developing protocols, for concept mapping and that kind of thing. And along with the project management that we do in the planning stage, there are tools for communication to consider, where you're going to store your files, tools just for project management. Of course, in the identify step, we always think about citation management. I didn't add it on here, but there are also some software tools out there to help with the search itself. Then for the evaluation step, there are tools available to help for sorting, and I'm going to spend some time talking about some of those. There are a few tools out there that are starting to help do sort of an automated analysis or critical appraisal. I have not used any of those, but they do exist. And then in the coding stages, there's lots of different tools out there. I'm just going to talk about a couple and have some screenshots of those. And then at the end, you're kind of wrapping it all up. And there are tools out there for what's required in a systematic review, and most of those are really, really specific for the audience. So, for example, Cochrane really their tool is designed to walk their authors through exactly what it is that they're looking for. So what are we looking for? So I think it's pretty straightforward. As librarians, we do this all the time. We're always looking at resources and trying to figure out, you know, what's best for our patrons and for ourselves. The thing I think about most in systematic review tools is a lot of times it's a team, and it's really important that they be able to collaborate well. One thing that I have come across, especially in working with some hospital librarians and those like on military bases, and is that not all the tools are accessible to them, and that has caused some issues. So it's been like a great tool, except that maybe a few of our team members can't use it. And then when we think about cost, I'm going to be talking today about some free ones, but there's also the cost of learning and setting that up. So sometimes free isn't always great. And then there are certain workflow needs that you're going to have, and some of the tools do a great job for a really specific type of systematic review, and then it's not flexible enough to handle others. So sometimes I'll use multiple softwares throughout the process, and occasionally it's just one or two. So it just depends on the needs and how much of a team we have. Sometimes teams come to me and they already know exactly what software they want to use and feel really comfortable with, and so I'm happy to find out and learn about that product. But many times they haven't run a big project like this before, especially with the amount of data that we're going to be putting together. So for finding software, it's a constant daily struggle, Tracy says, for the military. Yeah, so I've been experiencing that with a few colleagues I've tried to work with. So I'm trying to work around it and figure out what to do. So this is called the SR Toolbox. So it's a database just of systematic review tools. And I found this several months ago. Maybe it was, I think it was just before last summer. And I really like to follow their tweets because that's how I found out about one of my most favorite tools, Rayyan, which I'm going to tell you and show you all about in just a few minutes. So it really helps to highlight new things that are coming out. What's interesting about this site is if you click on select a discipline, it only has a few disciplines listed there. So one is health, medical, one is social sciences, and has anybody ever seen this? Do you know what the third one is? It's really interesting, the third discipline that's listed on this site. So it's software engineering. Yeah, so it's really interesting that once software engineering, computer science, professionals have gotten into this, I've really seen a lot more growth in the software tools, and so I'm so excited that they're into systematic reviews. So check this out, and hopefully you find some new things in there, and also tell me about it. So I'm going to start with some tools that are designed to cover the whole systematic review process. And so I wanted to put some on here that also have a cost so you can know what that is, because I think sometimes we hear, oh, like Covidence or Distiller, and it's like, oh, you know, I hear like those praises and everything, but when you think about how expensive it is, it's kind of shocking. So I used Covidence for almost a year before they started charging. I still have maybe 20 reviews that are finishing up in there. But even before it had a price on it, it was still kind of limited, and then it was really designed for effectiveness reviews and mostly focusing on randomized controlled trials. They may have expanded that a little bit, but what was happening was that I was having students who were just using it for sorting, and then when it came to coding or appraisal, they couldn't really do much more with it, so we needed something else. I have never actually got to try Distiller. I've watched a few videos of it. Mostly it's too expensive for me. But I know that some libraries have a limited amount of licenses that they allow those groups or clients that have their protocol ready to go or something like that to use it. I'm not sure about how they figure out who gets to. I would have to think about which libraries have distiller. It's only a few that I know of, and I know they have less than 10 licenses. Anyways, so the one I'm going to show you is Kadima. This one, it looks really promising. I've only been doing testing in it. So I'm going to show you some screens. It's interesting that it has one version that's for any topic, and it has a special version that's for really specific type of reviews. So reviews of crop genetic methods. So I thought that was really interesting. There's also another one that's free, but it's called Hawk, and it's really specific to reviews of chemicals. So I have used that on 2 reviews here at A&M because one of the professors here helped to create it, and so I got to see a little bit about how it works, but it's really specific. Of course, and there's always RevMen. So let me show you some screens from Kadima. So Kadima is completely free. What's nice is it has kind of a little sandbox so that you can go in and try it out and see what it can do. So I started one here. So I just created my own account. It just took a minute. And then under settings, you start off with what is your title. So I just wrote, how does Kadima work? You can use this for a systematic review or more of an evidence map or a scoping review. So I thought that was interesting. Under question type, you can do PICO, like an effectiveness question. For this one, I chose population outcome. So this is more of might say prevalence kind of a question. And then you can see here that you could add a team in. And then from there, you can start to build your protocol. So I just have a few other screens on here to show you. So I thought you might be mostly interested in, well, how do you get the search in there? So here I created a search, and you can actually see that search there from PubMed. I pasted it in, so I'm able to store the actual search, and then I uploaded a file of the citations, and so I was able to see like what date I did that. And then after that, you go to a screen where you can start to put in your criteria, and then another screen where you can start to assign how many users would have each reference. I think I must have not done this correctly, or there was another step I missed in between because I could never get the references to show up here, but maybe in the trial version you don't really see its full functionality. But then you can see that you can go through and you can create your own data extraction and your own critical appraisals. So in that way, I found it to be really flexible. A lot of the products that I will see are so locked down to randomized control trials or whatever their specific focus is, that for me, that causes big problems when I have students and researchers who are doing all other types, looking at all different types of studies. So anyways, I thought it looked really promising. I just started looking at this a few weeks ago, but I thought I'd show you a few screens. So you might want to check it out and see if that looks helpful. So I just put in a few things here about searching and retrieving. I think we've talked already about the searching tools. I just put those on here kind of as a reminder. This screenshot here is from the Yale Mesh Analyzer, and this allows you to analyze mesh terms within PubMed articles. And so I kind of highlighted in green ones that were similar. So I was doing a search trying to find articles on canine cataract surgeries, and I wasn't sure of all the headings I should use for that. So I kind of highlighted those here. And then when it comes to what kind of software for your citation manager you should use, I used to really be totally using RefWorks. I had lots of handouts on RefWorks and how to use it. for the sorting part of it as well as the collecting part. I don't really do that as much anymore. Now I use RefWorks in Zotero once I've done the initial screening, which now I'm completely using Rayyan for that. I'm going to show you that on the next screen. But I did want to say on the website, the Google website I created for this webinar series, I have posted several articles there under the bibliography section that are all about how to use different bibliographic management systems for systematic reviews. And some get really in-depth and have lots of great information about how they're using it. Since I found Rayyan, I don't want to try and use any of these tools for a lot of the big sorting. I use it more once I need to find the full text, and that way for the user it makes their it makes things less complicated for them. So I think once you see Rayyan, you'll see what I'm talking about. So my next screen is about the sorting. So Rayyan is the one that I really like. I did want to put Abstractor here. Abstractor's been out there for a while, and I recently worked with some researchers who had been using Abstractor for a while. And I asked them how it was going, and they said the same thing that I had noticed, which is when I need to search ERIC and other types of databases other than PubMed, so it's a little harder to upload things. And it doesn't do quite as much as like Rayyan and a few other products that I've seen. So now let me show you Rayyan. I can tell you when I first saw Rayyan, I got goosebumps because I realized it was going to change my life, and it really has. So Rayyan is completely free. I'm actually running probably over 70 reviews in it right now. And I've been doing that since probably last August. So I go into Rayyan, you can create your own account there. And then I've kind of tried to show you here where I clicked on New Review down at the bottom of my list. And I can type in a title, I can give it a description, and then click Create. If I were to have clicked on one of my other folders that's already running, then you would be able to see how many have been sorted, who's working on it. It has the ability to mask users so they can't see each other's decisions. And I just click Invite, and I can just have a string of emails with commas between them and invite several people at one time. So it's really a nice dashboard reminder of all the reviews that I'm working on. And so my reviews are showing me the ones where I started that folder. My collaboration reviews are ones where somebody else started that folder and then invited me in. The other reviews, those are reviews that have been made public, and so they might have lots of people coming in and out to do some sorting for them. I'm going to show you a few more screens here. One interesting note is that it does show you how long you have spent in that account. So on some of them you can see the students have spent many, many minutes and hours in there, and then you can see I just spent a couple minutes in here when I was uploading the results. So on this next screen, this is showing you what the user will see once I've uploaded things. And so it does help to show me the duplicates. And if it had automatically determined that some were exact duplicates, then it would have put it into some piles here for me. And when it's unsure, it puts them into the unresolved. And what's nice is I could then click on that and unresolve them. I think the next screen might show that. And then when I click on a title, as you can see here in this gray bar, the third one down, then it will show me the citation for that. The words that you see highlighted in green, we modified this to list the words that we were looking for. So in this case, they are interested in articles looking at communication between patients and providers on sexuality. And so we had it highlight in green any words that were helpful to us. And so under keywords for include, you can go in and you can modify those. It just makes it easier for the client to read through them. Okay, so then they can choose include, exclude. If they exclude it, they can choose a reason, and those reasons are they're already preset, and so to make it more flexible, they can also add labels. Whether they include or exclude, they can create a label. And then the labels and the reasons would all appear in another one of these kind of orangey boxes over here on the left side. Does anybody have any questions about this screen? I know there's kind of a lot to take in the first time you see it. It does have a place where you can chat. It has a review chat there, so you can click on that. And so clients could meet in there as a team. One thing I didn't point out is that it would collect anything where the clients did not agree on something. So under conflict, you could see that's where they did not agree. So somebody's asking about the PDFs. I actually haven't used that feature of Rayyan. What I usually do is after they have sorted, I will export their included into RefWorks, EndNote, whatever they prefer, and then have it find the full text that way. It would be interesting to approach Rayyan and see if they could add a link that could be modified depending on your institution. That would be super helpful, because then this really could do all of it, at least all of the sorting that you need to do. But in this, so once I have sorted them, I would click on, let me see what my next screen is. Oh, let me go back. Once I've sorted them, I would click on included and then choose export. And also an export to EndNote, RefWorks, although it doesn't have a nice easy button for RefWorks. I have a workaround for that. Or to Excel. And it allows you some options in exactly what do you want it to send over. And it is very fast to upload documents. I'm going to show you how do you add a search results into here. So I click on New Search, and this is for you to upload articles. You can upload EndNote libraries, RAS files. For PubMed, I use the XML, and it has a lot of good guides here as to how to do that. And then so once you upload those, then they will go back onto the other screen. And so one thing that I suggest is when you're uploading a file to name it with the name of the database and the date. So at least that if I just look at the file name, I could tell you what it is. You will see that file name over here under Search Methods. It's kind of 4 boxes down on the left side. If I was on the live version and I hovered my mouse over one of those uploaded references, you would see the full title has the database name and the date and things like that. Let's see. So there are a few issues with Rayyan. One thing that we've noticed, especially with PubMed, is sometimes when I import the data from PubMed, Rayyan will show the authors' names out of order, so the first author is not the first author listed there. And then what will happen when I export that into another tool like EndNote or RefWorks, it's wrong as well. So I'm trying to do a little bit of testing on that and see exactly what's going on, because it's not happening with all databases and it's not happening all the time. So if anybody knows anything about that, I would love to know like a workaround. So what we've been doing is just once we picked our included, I've been scrolling through to see that the first author name is right, and if it's not, then fixing it from there. But it hasn't been a huge problem, but it's definitely something to look at. So when I go to upload the files, so when I'm uploading onto this screen where it says select files, when I export the, let's say I go into Medline Ovid and I download 800 results from a search I did in there, I will name it with the name of the database and the date that I pulled those. As far as that's the file name I'm talking about, I wasn't talking about the individual like PDFs or anything. That might be a little different. Yes, Rayyan does dedupe. They just added that feature not too long ago. And so here we just haven't gone and resolved these 66. So the unresolved here, these would be like close matches. It did find these exact matches, and it's already taken those out of the pool. So I'm able to count those and see them, but it wouldn't be something that I had to sort. And then I didn't do a screenshot of how to resolve your duplicates. Sorry about that. But if I were to click on the unresolved set here of 66, then I would get an extra button next to the abstracts, and I could say duplicate, delete, or not a duplicate. And so you're looking at the purple tags. Cancer, spinal disease, let's see. Oh, okay, these tags, these are labels. So what this group was doing was they were doing a little bit of sorting of the included by their specific medical condition that they were mentioning. So that was something that the group had selected and designed themselves. So once you create a label, like so they created spinal disease as a label, then whenever they click on the label box, they could see what they've already created. So it's nicely adaptable for what they need. Do you have, okay. Yeah, so it gives you control of that, and what's nice is even if it deletes the duplicates, you have a running total here so you can easily see them. And I think one of the next items they're looking at is to create the Prisma flowchart. It's nice every time I go in, I get a little screen where I can vote on what I want them to work on next. So the first thing I voted for was duplicates. And then because I voted for it, they send me a nice email saying, hey, we worked on this for you. I know, how is this free? Yeah, so the first time I found it, I was like, oh my gosh, and I was so happy to have something like this. So I'm so thankful. I do have a few of these reviews have more than 2,500 articles. It really wasn't bad uploading them. It went fairly quickly, especially compared to other products that I've tried. And like I said, I have 70 reviews running in here right now, so it's been going well. And I have 2 different Rayyan accounts as well. They have said that they want to stay free. Everything that I've read that they've produced has said that they want to stay free. So I hope that they mean that. I know Covidence, when it first came out, they said at some point they were going to switch over. They just hadn't decided when. I don't know Oh, maybe it's going to be bought. Oh. I don't know what their storage size is. I haven't reached it, so we'll see. I'm going to be going. This Rayyan comes out of the Qatar Computing Institute, or I might be messing up their name, and they're going to be at EAHIL, which is like the European version of MLA. And so I'm hoping I get a chance to talk with them there and see what their plans are. And I do have that question of, are you going to stay free? Because I think it is so useful. Okay. So now a few more types of tools. So one thing that happens after they've done the sorting is they'll need to code the articles, so basically looking at the data, pulling the characteristics from each of the studies. And they also need to do that appraisal part. So there's different tools for that. I've used Google Forms, and I have many students use that and are happy with it. I've also used Qualtrics, which the university has a subscription to, but you can also use a free version. I'm going to show you some screenshots from there. And then the last one here is the Systematic Review Data Repository, which ARC put out a few years ago. And so I'm going to show you some screenshots from there as well. So last time I talked a little bit about Qualtrics, and there were some questions about how would you use that. And so kind of use Qualtrics and Google Forms in a similar way, because both of them seem like they were designed more for surveys than for maybe what you might think about coding. So Qualtrics does have a free version. It couldn't do a lot of articles, so you can see here it's just 100 responses. So I don't know that it would be great for like everything, so you might then want to think about a Google form, which wouldn't have that kind of a limit. The emails, that wouldn't really matter. It has plenty of question types for it, and you can just have one active at a time. But it's great with being able to skip over questions. So sometimes I have users who are trying to code randomized control trials and cohorts and surveys and all these different study types. And it's nice that if they, at the beginning, were given a question like, what type of study is this? And they selected, say, survey, then they could have maybe a slightly modified set of questions automatically because we built that into the form. It also helps a lot when you have multiple coders because they can be doing it all online and then it can be compared, and it also helps with the analysis. So I'm going to show you a few screenshots of some tools that I've used, some coding forms I helped develop. So I kind of did, this is kind of three different screens here. So the one that's closest to the top, this was showing how I copy and paste in a list of titles. And so here I've kind of highlighted number 75 in blue. So each article gets a reference ID, and then I also put in the title. And so I just have whatever bibliographic manager I'm using give me that a list with a number, whatever number you choose, if you're choosing to do that, plus a title. And then the user just has to select from that list. You can't copy and paste more than, I think it's 500 into Qualtrics. It's a shame that I know that. So then I had to batch them into different groups. So then they had to end up picking a batch. Sometimes, in this case, I batched them by date. Other times I've said A, B, C, D, depending which group they were in. I do have a few times I've done this where we have more than 2,000 forms filled out, but that's only in our subscription-based version, so we have a lot more leeway there. Then this next screenshot here is just an example where we were picking the institutional setting, so they could only pick one. Here you see those are the circles, and then I always try and put an other box in because the last thing I want is for somebody to go and code something and then it's like, oh, I really needed to put this information, but there's no place to put it. So I almost always suggest adding an other. And then here we were looking at the targeted population. They can mark all that apply. And then this last question, they were doing a little bit of appraisal here. We actually did an even a more standardized appraisal checklist as well. This was kind of our initial, how do you feel about this article kind of question, which we didn't end up using for our analysis. It was just there in the beginning. So the next screen is going to show you some of the analysis that Qualtrics does, and you might have used this for surveys and things and already seen this before, but it does some nice visualization. And so in this case, this was looking at the targeted student population. And so it's easy to see. We had meant to just find things on Hispanic students, so that was good. That was about 1/3 of our articles. And then we have lots of other populations represented. You can export into tables as well, yeah. And also into SPSS. Those are the two main ones I'm thinking of right now. So a few tips for Qualtrics. One thing that's for some reason not part of our default is the back button being turned on. So a lot of times I've got to go in and make sure I turn the back button on, so if the researcher needs to go back a few screens, they can. The other thing I do is after I click distribute and I get the Qualtrics link, I will copy that. Then I will go back and I will edit the end of the survey message. Usually at the end of a survey, you get a little thing that says, oh, thank you for submitting your survey. When I'm doing this to code, usually if I've been, I want to code several things at one time, it's nice to have it built into the process to say, oh, do you want to code again? Here's the link. So I just changed that end of survey message and have that link right there. And this, with any of the processes in the systematic review process, it's a good idea to have them test it out with a few articles before they do a whole bunch. And so usually I say pick 1 or 2 really representative studies, have everybody who's going to code both of those, see how it's working, and make sure this is going to run smoothly. I also like to show them the what the results screen is going to look like, because sometimes that will influence the type of question. Maybe they want it to be, maybe they were thinking, oh, I'm just going to do everything open coding, which is fine when you have just a few articles, but when it really gets up there, it's nice to try and do some categorization earlier in the process. And so in a very similar way, I use Google Forms. Google Forms can't do quite as many different things as Qualtrics can do, but it really can go well. One thing when coding this way in Qualtrics is if somebody only codes, let's say they just code 5 out of 20 questions and then they need to come back to it, you can go back into Qualtrics and find that one that you were working on and open it up in the form view and then finish it up. I haven't found that as easily in the Google Forms. You usually have to then go and edit it on the table. So this is asking about from Rayyan to Qualtrics. So there really isn't any information to put into Qualtrics from Rayyan other than if, let's say, here's my list of included articles that I now want to code. From Rayyan, I would export into Excel, and then I would have that list that I could copy of the titles. Because I don't need to then, in the coding form, also put in the year and page number and all of that, because I still already have all that information. But usually it's a good idea to have some kind of way of easily identifying that article other than the title, and usually I assign it a number. And so using Excel, you can always match those back up again. So hope that answers your question. Okay. So I have a few screenshots here of SRDR, which is a Systematic Review Data Repository. This is more designed for leaning more towards effectiveness reviews. You can use it for a few other reviews. This will only be helpful once you're to the stage of here's the articles we're going to code, and you can develop the coding form within SRDR, and I'll show you a couple screens there. What's happening now is some grant funders are saying, okay, we're going to fund this systematic review, but you need to make publicly available all the coding forms and the data from this project. And so especially this second one listed here, this diet-related fibers database, that's exactly what it was designed to do. They did not actually complete and do all of the analysis for this grant. They mostly coded articles enough so that others could then come and look at those studies and pick a group of those to then do an actual systematic review on it. I know a little bit about this grant. I helped to work on some of the initial proposals for it. Ended up that a different group actually won the contract, but I got to find out a lot about what they were looking for. So I'm going to show you a few screens from here. This is what you get at the beginning when you start to fill in the information. So I just started a practice database. I gave it some information. If I had also started working in Prospero, which is a place where you can register protocols, I could add that in here as well. And then I uploaded a few articles, and so here's where I was adding studies. It understands PubMed very well, so it's easy to add from PubMed. Otherwise, I can do it manual. I can add articles manually. And so here I started adding a few in, and then I can assign who it's going to go to, and I can edit from there as well. Over here on the far left side, you can see that then after adding the study, you can then create your data export tool and what data are you going to pull from. If you already have some data, it even allows you to import that data, and it will put it, once you tell it, the right place in your form. So, and you can store some files on here as well. So if you have a need for being able to especially share those coding forms, but you don't have to, but you can, this is a really helpful tool. I took a couple of online webinars about it. It wasn't extended, but their support was really nice and helpful at that time. It's been a few years since I've done a lot of work in it. So I just have a few more other types of software to talk about. One thing that has happened to me is, you know, I'm usually asked to create the Prisma flowchart, and sometimes the journal will ask for some weird output. And the latest one was it wanted vector something or other. It was a very strange formatting type I've never heard of. And so there's the Prisma flow diagram generator, and it's really nice because you just go in and you can type in the information, and then you can get all different types of output out of it. And so that's going to be on that Google site that I showed you in the beginning. And also give you a quick link for it here. So I've listed all the tools that I'm talking about right now in there. And then if you had any other diagrams and you were having some issues and like, well, how do we get these in the right format? I also put in a link to this graph editor because sometimes I've had clients where they've produced this really nice logic or their concept model, and then they have issues in it being in the right format needed for that specific journal. So, so sometimes we have needs for those. There are lots of tools out there for meta-analysis, so I wanted to show you just real quick 3. MLIS is from EPI, the EPI Review Center. It's really nice. It's really helpful for especially professors who are trying to teach meta-analysis because you can go in and easily play with these numbers here and see what happens to the forest diagram. I'm no expert on this. I just know enough to get into trouble. And so, so I know that that has been helpful. JBI is suggesting open meta-analysis since their platform has been having issues with their meta-analysis tool. And then if you know that your users are using the R software, there's also Metaphor, which is designed to help with that. So I thought I usually try and give my clients, if they tell me they're doing a meta-analysis, some options where here's some tools you might look at. I'm very grateful that I do have a meta-analysis expert who will meet with students after they've collected everything and talk with them about the analysis part, because I don't feel all that comfortable with that. I just have a few more screens here, and these are some more like project management, team collaboration kinds of tools. Sometimes systematic reviews fall apart just because communication is difficult, and as our campus is very spread out, even within the one campus, sometimes it's not always easy to talk, but then we have all of our other ones. So I usually look to PC Magazine. They do these nice descriptions of a certain type of product, and then we'll give it a rating and tell you why they gave it that rating. So I picked 3 types of software to put on here. The first here is collaboration/communication tool. The only one that I've been trying out lately is Slack. And the whole idea behind these tools is to use something other than your email. I think the hardest part is remembering then to go and check that other product. Slack does send me emails and reminds me, hey, go over there and check this out. So I thought I would put up a few of these. So there we have some recommendations there for Slack. Yeah. So I just have a few more slides like this one. So this is on project management. I have used Zoho products in the past. It's been many years since I used that. I actually don't use any kind of project management tool right now. That's probably not a great thing that I'm not doing that. So this is a question about EPI Reviewer. EPI Reviewer is a great tool. It does have a cost. I think I didn't go over that much in the beginning, but I haven't been able to see a lot of it. So I can't really talk too much about the EPI Reviewer, but I did have that on the slide. So here's some other tools. So I'm definitely not expert when it comes to project management tools, but I did show you this is the list. And so Zoho projects got the highest number of stars from their editor, and then the teamwork projects got the next group. So I thought I would put that up there so you could see that. So some different products. Yeah, so so I was trying to limit down to just those that have a free version available, and some of you who've done a lot more work in this area probably know about many others. So this last screen is just about files. So right now I mostly use Google Drive. Our university recently bought, has some kind of deal with Google. I'm not exactly sure how it works, where we have a lot more space on Google Drive, and so it's a really easy way for me to share with my clients. However, I think I'm going to get really up there in our storage. I think they've upped ours from 15 gigabytes though, so I'll have to keep an eye on that and see what happens. But no matter what tool you choose to use, it may be something that your campus has a subscription to. It's just making sure that everybody on the team knows how to use it. And I've also used Dropbox with many teams as well. My only problem there is I have like 4 Dropbox accounts. So sometimes I have to remember which one they shared with me. So we're getting down to the last few minutes here. So next time we're going to be talking about supporting other types of reviews. So we're going to go into scoping reviews, rapid reviews, integrative, all of those types of reviews. I posted the link to the Google Sites here again and my email. And so does anybody have any last questions that you want to ask? Oh, thank you. Thank you for coming. I hope I showed you some new tools you can go and try out. And I would love to hear from anybody about any others that I missed, because there's so much out there. There's so much coming out. So you're welcome. So I know that, I think I took Gate off of the final version of this PowerPoint. I don't really know that much about it. I was going to try and do some research on it, but I didn't get a chance, so sorry about that. If you find out anything, let me know. So I'm going to turn it over. I know they want to ask, they have a few questions to ask you.
All right, thank you so much, and thank you for all of your participation and questions today. We have just a couple quick items to take care of.